Some people truly have no idea the reason why they are getting headaches. And if it's a migraine headache, it could be so debilitating. And it's hard to say because maybe it's actually an easy fix, or maybe it's a huge problem and a big underlying condition that we need to address.
I actually used to be a migraine sufferer myself. And so I know it from the inside out, and I just pushed through. I didn't know how to make them go away. I was able to manage them, and I very rarely, if ever, get a headache anymore. And I find that to be true for my patients as well. Sometimes all I have to do is do an adjustment or a cranial technique on them or something, and that's all they need. And those are the easy ones. The other ones are the really frustrating ones that just have a hard time getting better. And when we get them on the correct nutritional supplementation that's very individual and organ support, then they come along.
What are the primary symptoms? Is the person having migraines that are coming around the temples? Is the person having migraines that are in the front of the head? Are we having it at the vertex? Are we having it kind of in the occiput or the back of the head? And so there are different herbal formulas that target those specific areas, whether it's frontal, whether it's side, back, or top.
And to have somebody feel that level of intensity and then feel where you are and move you forward to their best of their ability, and then use their assessment tools to figure out, is it hormonal? Is it neurologic? Is it mechanical? Is it musculoskeletal? Or any other body parts? What can I do to help you on those avenues? Okay, what have I not explored, or what do I need? Do I need to go to nutritional response? Do I need to go to acupuncture? Do I need to go to outside to allopathic medicine, and then move forward from there?
Hello everyone, today we're going to talk about headaches, especially migraine headaches, and how to get rid of them naturally and fast. And you know, many people suffer needlessly, and that's because they never address the reason why they have headaches. And if this is you, or if this is someone that you know, watch this video, also share it with others because it can really help them. Today we're going to be giving some very helpful tips, but it's important for you to know that we are not giving you medical advice and we are not replacing your doctor, but we may surprise you with some very valuable tips. We encourage you to comment if you have any questions, or maybe you know some solutions that work for you, have worked for you. Feel free to share them because it can help other people as well.
So great to be here. Welcome, everybody. We are a doctors networking group where healthcare providers collaborate to achieve the best clinical outcomes. And we have found that collaboration is the key to growth as doctors and as clinicians. So we have a great group tonight. You just heard from Polish Mike, the group organizer. Thank you for the intro, Mike. Down, we have Dr. Todd Johnsonbaugh, who is a co-host from the Dad's Rehab Center of Maryland, and is an excellent chiropractor in his own right. And we also have Dr. Lisa Gordon, who is our guest from the Natural Health Improvement Center of Columbia. She is a chiropractor and master of nutrition response testing. And I am Ryan Diener, the senior acupuncturist at Holistic Health Associates in Frederick, Maryland. So happy to be here with everybody. And Dr. Todd, tell us how we're going to kick this migraine conversation off.
Give us a 30-second description of your like a migraine patient that sticks out in your mind that had gone to different avenues, and tell us how they came to you and what you guys did. And I said 30 seconds, it's going to be quick, tricky. And what you all did to take their health to that next level. I love to hear these stories, and I think we can go from there.
So I've had many migraine patients, and most of them have been through a series of medications and spent a lot of time in dark rooms, and just some of them have just plowed through their days. I actually used to be a migraine sufferer myself. And so I know it from the inside out, and I just pushed through. I didn't know how to make them go away. And sometimes the chiropractic adjustments I got from either Dr. Todd, because he and I used to work together, or other people really helped a lot. And other times they didn't. And I got really frustrated. I went to a lot of seminars trying to learn myself how to get rid of my own migraines. There are other people who just end up in my office because they've heard that I might be able to help them with the technique called nutrition response testing. And that's actually the thing that helped me the most get rid of my own migraines, because I found out that it was glandular, it was my thyroid that was causing my neck to stay out of alignment and my headaches to continue to occur. So once I found out how to manage my thyroid by way of other organs, everybody's different, I was able to manage them, and I very rarely, if ever, get a headache anymore. And I find that to be true for my patients as well. Sometimes all I have to do is do an adjustment or a cranial technique on them or something, and that's all they need. And those are the easy ones. The other ones are the really frustrating ones that just have a hard time getting better. And when we get them on the correct nutritional supplementation, that's very individual, and organ support, then they come along.
I think there's so many of us in the health and wellness field that deal with migraine sufferers. And it's like, it's one of those things that there aren't great allopathic solutions for. And so we always talk about this on this group, that sometimes when there is an allopathic solution that isn't meeting the needs of a particular condition, that's where people end up finding us. We're always the second fiddle, but that's okay, because if we can make a difference, that's what matters. And so, so we see all kinds of different neurological conditions, and migraines is a common one. And so the first thing that we'll go through is trying to determine what is the cause of the migraine. Is this a hormonal issue? Is this a dietary issue? Is this a neurological issue? Is this a genetic issue? What's the origin story first? And once we can kind of gather that, then that can dictate the direction that we go with acupuncture. And so, acupuncture and herbal medicine. So many times we see people, and I actually changed all the blinds in my office because of migraine sufferers, because we would have all these people come in and they'd need, they'd be light sensitive or they'd be sound sensitive. And here we have light coming in because we want it to be bright and positive. And so, there's a number of things that you have to do in order to create the right environment for healing to occur. So, and so we'll determine kind of what are the primary, origins, and then what are the primary symptoms. Is the person having migraines that are coming around the temples? Is the person having migraines that are in the front of the head? Are we having it at the vertex? Are we having it kind of in the occiput or the back of the head? And so there are different herbal formulas that target those specific areas, whether it's frontal, whether it's side, back, or top. The most famous one that we use as usually the first, line of defense is actually it's called 5-flavor tea decoction. And it has a different herb for each of these specific areas that targets those specific areas. And it's used in green tea. And as most people know, a little bit of caffeine can make all the difference in the world for some migraine sufferers, right? And so 2,000 years ago, a formula came out where we used a little bit of caffeine, which is the green tea. And this was long before there was science behind caffeine being something that would help dilate blood vessels in the head. So we usually start people on a formula like that. And then in conjunction, we'll do acupuncture based on the pathway that either comes over the side, in the front, top, back, and then combine that with their origin story and figure out what the right points are in combination for that patient.
And I want to ask Dr. Todd a question about cervical misalignment being one of the reasons why people can have headaches. And there are two perspectives to keep in mind, because we are in the group, we have some people who are healthcare providers themselves, and we want to talk probably a little bit later when we talk about solutions, how that collaboration actually is very important from the patient's perspective, but also from provider's perspective. How do we make it easy? So we leave that towards the end of the video. But from the patient's perspective, what I found very interesting is that some people truly have no idea the reason why they are getting headaches. And if it's a migraine headache, it could be so debilitating. And it's hard to say because maybe it's actually an easy fix, or maybe it's a huge problem and a big underlying condition that we need to address. So I want to talk specifically about the one that a lot of people don't know that could be a relatively easy fix. And this is cervical misalignment. So let's talk about it, Dr. Todd, if you don't mind.
Yeah, I'd love to. And a lot of times, cervical misalignment just refers to those wonderful vertebrae. And yes, we have 7 cervical vertebrae, and then we go down through the spine. And chiropractic theory is all about when those bones fail to move in proper ways. You can get pain localized, you can get muscle spasms, you can get pain that from nerves being pressed that travels to an area. And finally, also, you can get hormonal imbalances in that area because you don't have an infusion of proper movement. But a lot of times when people say, you know, Todd, like I've had a headache for 10 years. And I go, well, what happened? Let's go back 10 years ago. Like Ryan was saying, let's find their story. And I remember one patient came in and she was going, yeah, it's never been the same. When I was a kid, I was running around playing tag. And she says, you know, those air conditioning units that hang from a window? Well, I didn't see it. And I ran smack dab into that. And some reason or another, 3 years, 3 weeks later, I developed these terrible headaches that occur pretty frequently. So, wow, we had trauma, a marked traumatic event. And then all of a sudden we had headaches that had continued. And I said, wow, well, let's take a look. Do you think you might have suffered some injury to your neck and around the head? And they were like, well, yeah, but it kind of, the major stuff resolved, but I was left with these headaches. Let's examine. And then you check the motion in that area, and lo and behold, there's something. And they go, oh, by the way, when you press here, it sends pain to another area too. Wow. Well, that's pretty darn easy. So you just start to give the person those adjustments, and you do it in a form that's not too stressful for the body. So you meet the patient where they're at and their level of stress that they can tolerate, that moves them forward, challenges them a little bit to create a healing response, but not too much. And then you make sure after you do that, manual therapy could be in the form of manipulation, manual therapy, soft tissue, whatever you like. And then finally, you also give exercises to enforce those habits that hold those bones in place. And so then, boom, they start to feel better. And that's just chiropractic in its purest, most wonderful form. And every day we hear great things about it. I get giddy with excitement just talking about it.
Love it. Love it. And Dr. Todd, what is the soonest that you have ever seen a major improvement in those symptoms, if this was in fact the reason why?
Well, Dr. Lisa can attest too. Sometimes it's just instantly. And then a lot of times people go, oh, I got more range of motion. And then that night they fall asleep, get a good nap, get a good sleep. And then they wake up and go, wow, something profound happened to me. And then with time and remodeling the body, those adjustments hold longer and longer, and they feel better. And it's one of the ways that we reduce the stress on their body. But there's so many stressors on the body that, so sometimes, yeah, if a vertebrae are out of place or the person's tense and moving abnormal, that's one stress. But all the different things that we're talking about remove different types of stresses on the body. And when you decrease stress on the body, you also help reduce the likelihood of a stressful event. And if that person is wired, unfortunately, to experience migraines, then as their stress bucket fills up, they're more likely to experience more migraines. Chiropractic adjustments to the neck is one way to reduce that stress bucket. But I want to hear about the other providers, how they reduce stresses on the body also. So guys, just whoever wants to jump in, go ahead.
Well, you're exactly right, Dr. Todd. Occasionally that adjustment will give immediate relief, and that's always so satisfying to both us as the doctors and to the patient. Gives them so much relief. You can see it in their eyes a lot of times, and the color comes back to their face. And
that's right. Oh, that red reaction, like when Ryan, you get that too, right? With the flushing of the face when they feel better.
Oh yeah. Oh yeah.
And they come in so pale because they feel so awful. And then you're right, they get a better night's sleep usually, and then they feel better in the morning. The other thing is sometimes they're dehydrated. Sometimes it's really something simple. They might be dehydrated, or they might have their workstation set up incorrectly. You know, Todd, you're so good at that, at setting up people's workstations ergonomically, and they're on their phones. There's so many things that we can talk about, and then maybe they haven't eaten their dietary things. Maybe they've had a lot of sugar. So there are a lot of approaches that we can take, and conversations that are important, ways that they can affect their health. And in fact, all of those things can cause these things we call subluxations in chiropractic, these smaller than dislocations that end up causing nerve interference, and then the pain happens, and other symptoms often occur as well. So those are all opportunities for us to teach our patients and to remember ourselves as well.
Dr. Lisa, I'd love to just follow up with that for you to talk a little bit about the nutrition response testing and how you use that to maybe determine, how would you use that with a migraine sufferer? And maybe just start by what is nutrition response testing for those people that might be listening that don't know.
Sure. Nutrition response testing is a method that uses the language of muscle testing to assess the organs and glands of the body. We can find out whether an issue is completely structural, or if there's some chemical or nutritional need that the person has, some nutritional deficiency or organ dysfunction. And then we can find out what might be causing the body to not be able to heal. So we assess metals and chemicals and foods and immune challenges, even scars on the body, to see if those things might be interfering with the healing process. And then we find out what organs need to be handled first. So even though I'm hypothyroid, as an example, I mentioned this before, it wasn't my thyroid that needed to be handled first. It happened to be, in my case, my adrenals. Sometimes it's the pituitary, sometimes it's the liver, sometimes it's the heart. It's different for different people. And with nutrition response testing, we can assess and figure all those things out. So people don't, and then we use nutritional supplements, natural nutritional supplements to handle them, but we don't have to guess. Again, we can find out exactly what a person needs. Do they need this one or that one? Because it's not always the same for any two people. And so if someone comes in with migraines, oftentimes I'll start them with chiropractic, and sometimes they've been to another chiropractor and they still need that chiropractor to work on them. You know, I make sure that I send them back to their chiropractor, and I do get referrals from other chiropractors for nutrition response testing, with their understanding that I will, if they need an adjustment, I'll send them back to that chiropractor for if they like and trust their chiropractor. So sometimes it really is a combination, and I might, if it's a new patient to me and they don't have another chiropractor, I might start them with chiropractic adjustments, and 2 or 3 visits in, if there's no change, I might suggest, let's just do an assessment, a nutrition response testing assessment. And occasionally the person might just present with so many symptoms that it's clear that there are some nutritional deficiencies and organ dysfunction. So I might start with that, and then if we need to add chiropractic later, we can, or I can send them back to their chiropractor, whichever. I hope that answered the question. I think that was a lot, but there you go.
All good. No, that's great.
Yeah,
that's great.
Brian, tell us more about the world of acupuncture, and how that, we talked about the different places, but give us a little bit of a sample of what does that look, what does more acupuncture look like? We understand chiropractic pretty well, Dr. Lisa and I, because we're chiropractors, but give us more about the patient's perspective about acupuncture, and how do you determine that? How would you, as a patient, find an acupuncturist for migraines? Like, what's the search like? And then Dr. Lisa, I want to ask you the same question. Like a chiropractor, how do you find us? Well, you look online, look for referrals. How do you find a good nutritional response person for migraines? How do you find a good nutritional response person for migraine person for acupuncture? So Ryan, take that away. And I'm sorry to be confusing with that, guys.
No, it's good. You know, I think this is always a challenge, is trying to figure out in a field that is generally where most people are generalists. How do you determine if you're going to somebody that knows what they're doing, right? And
Yeah.
there are definitely specialists that are headache specialists within the world of Chinese medicine, but it's rare. You don't see very many of them, and part of that is because it's part of all of our training. You know, it's something that we all see. It's something that we you know, neurology is really at the heart of acupuncture. You know, you're looking at, you know, electrical nodes that are occurring most likely in the fascia system, and how those are all connecting through into, you know, something that will exacerbate blood flow to the head or something, you know, of that nature. Is one of the hallmarks of the way that we treat through pathways. And pathways mean, you know, you're going to look at potentially, I'm going to back up a little bit. You're going to look at potentially the index finger and follow a particular pathway up that's going to end up coming straight up into the front of the face. Well, if your migraines are kind of coming up this way and maybe kind of coming over like this, that's going to be a sign. That's going to be one of the signs that we need to use that pathway. And the way I'll test that is through looking at if it shows up in a particular diagnosis related to your pulse. If it shows up in, believe it or not, in your tongue, we're going to look at your tongue and we're going to see, does it, you know, in this case, we'd be looking at where is the tongue red? Where is it swollen? And are there specific areas of the tongue that relate to the pathway that comes this way, the pathway that comes this way, the pathway that goes in the back, or the pathway that goes in the top? And so there's a couple of diagnostics that any acupuncturist should be using. And so if you go to an acupuncturist and they're not checking your pulse, they're not looking at your tongue, and they're not trying to assess your headache in that using certain diagnostics, then the likelihood is they're not clear about what they're, you know, what they're looking for. So you can just ask. You just ask you call up someone that you know you think is a good choice. And you say, how do you assess migraines? And just see what they tell you and see if it's not, you know, if that lines up with what I'm describing. That's the typical way that we would assess it. And then, you know, you'd like to ask if they do herbal medicine. You know, herbs are really powerful when it comes to things like neurological or internal medicine issues. And so, you know, many acupuncturists utilize herbal medicine, many do not. And so that's another differentiating factor when it comes to anything that you're dealing with internally. And so, you know, so first step would be see if there's a specialist in your area. Likelihood is that there's not. Second step would be make sure that they're doing certain diagnostics and they have the tools in order to follow. And then, you know, from there, then it's all about, you know, the results. And, you know, the nice thing about the things that we do is you can, as a patient, come in, try chiropractic, try acupuncture. The likelihood is that the worst thing that's going to happen is that you're just not going to get the result that you're looking for. And if, you know, I think we can all speak to the fact that doesn't happen too often. You know, we all are doing our best to get the best results. But the benefit to the patient by going the way of some of the things that we do, I think one of the big benefits is that there's nothing, you're not going to get stuck on a medication. You're not going to have to do a surgery. You're going to just either see the benefit within a few sessions, as Dr. Lisa was talking about, or you won't.
I have a question from a patient perspective. Let's say somebody is watching right now and they are experiencing headaches. They don't even know if it's a migraine, or maybe they are diagnosed with migraines and they know it is migraines. But knowing that it could be, our body is so complex and it could be so many different reasons why. How do you watching this, how do you self-assess what you should do? Because it could be something as simple as dehydration. So maybe drink a little bit more water and then your headache will go away. Maybe it's going to be something related to your diet. Maybe your body is toxic. Maybe you had trauma that is just causing vertebral subluxation complex. Maybe it's going to be high blood pressure. Maybe there is a serious neurological issue. So if I'm watching this and I'm thinking, okay, I have headaches. It's great that chiropractic can help. It's great that there are so many different tests, but now it's COVID. How do I know if I should be concerned or I should be okay with Advil maybe a couple of times a day, like some people take for a month, and maybe the headache is going to go away because it's a normal headache, because people use the term normal headache. And I would like to suggest that there are no normal headaches. It's not normal to have headaches, because Dr. Lisa, you go so in depth when it comes to not only analysis, but also the treatment modalities, from the cranial sacral therapy to nutrition response testing. I wanted to ask you to give our patients watching this, or our viewers watching this, maybe some hints. When do you see a provider? How do you know if it's serious? And if you want to see a provider, who do you see? Do you go straight to a neurologist, or maybe you go to somebody else who's going to give you a good advice?
That's really tough. I think that it's probably a good idea to do the simple things first, to drink some water, maybe for a couple of days, see if that's going to solve it. Because if it is, great, you just drink more water. It's maybe, give up the sugar in your diet for a while and eat a better diet for a few days, see if that solves it completely. I do not recommend taking Advil for a month. I know nobody here does. If somebody's finding themselves reaching for the Advil regularly, they need some support. They need some help. Maybe they know somebody who's gone to either, one of us or a chiropractor or a practitioner who's helped them, acupuncturist who's helped them. I know we all help people with migraines, and so they could start there, take someone's advice. Hey, this doctor helped me. Why don't I call that doctor? And I always recommend to see if you like the person's staff. That's a really good way to assess a practice. I don't know, because you don't know who you're calling sometimes. If you move to a new area, do you like the person who's answering the phone? Because to me, if the person who's answering the phone is polite and caring, that's a good representation of that practice. That's one way to just see if that's a place you want to go. Sometimes you want to see if they take your insurance. I know Dr. Todd takes insurance. I don't take insurance. So my patient base is going to be different, but nutrition response testing and the advanced allergy therapeutics that I do are not covered by insurance. So, those are all factors. And I think that, sometimes people have gone to their medical doctors and they just don't want to take the medications. And I don't think it's a good idea just to suppress symptoms with medications. So they might have one philosophy or another. Maybe they've gotten fed up with that. In terms of how to find a good person who does the things that I do, I refer out all the time, all over the country. I have a place where I can get a referral. So if anybody here wants a referral for the nutrition response testing and they're not in this area or within an hour and they can't come to me, I can refer them. They can call my office and I can find them a referral. That's one thing.
Nice.
Yeah. Yep.
So maybe we can tell our viewers a little bit more about nutrition response testing, especially in the context of headaches, because what people may not understand is that what we eat affects our body, and it could be a long-term effect. And there are certain things that are very good for one person, and they literally could be poison for another. So let's talk about this type of assessment in the context of getting rid of those headaches fast. Because if this is something that I'm eating every day and I don't know that it's actually poison to me, one is I need to know about it, and then two, I need to know what can I do. Maybe it's eggs, and is there anything that I can do to turn it around and actually have my body tolerate that much better?
So if somebody wants to do it on their own, it's a bit of a process to do an elimination diet. Some of the things in inflammatory, Dr. Todd, you and I talk about this all the time, inflammatory diets, we talk about it with our patients all the time. Good things to try to give up first are sugar, wheat in the United States, because it's really the pesticides, it's not really the gluten in most cases. And that's a big conversation. So those are inflammatory things for some people. Sugar for everybody. The nightshade vegetables might be a way, something that they can give up for 2 weeks and see if they're the tomatoes, eggplants, white potatoes, and peppers. They can give up those for 2 weeks and see if they get better. If they don't feel well after they have eggs, they could give that up for a little while. They could give up dairy. Those are things that that sometimes cause headaches. Chocolate, caffeine, red wine. Those are all things that are pretty typical headache triggers. What I do in my practice, if somebody just really wants to find out what foods they're sensitive to, is another technique altogether, which is called advanced allergy therapeutics. And, we can just find out what somebody's sensitive to. And I do that advanced allergy therapy with nutrition response testing as well. So there are various ways that we can find that out. And some people who do muscle testing can find that out using less specific, but also useful methods.
I wanted to ask Ryan, because sometimes it's a relatively easy fix, or even if it's not an easy fix, that may be a relatively safe route that they can go, but sometimes there is a true medical major problem. So I want all our viewers to know that we are not saying that you have to get rid of headaches naturally, like it's in the title of this video, because there are situations that require the intervention, maybe even surgical intervention, if there is a tumor that you need to know about first and then know what to do about. At which point, Ryan, because you also go very complex with your assessment, diagnostic testing, at which point you would refer to a neurologist, for example, or a different specialist, because we promote collaborations in the group, and I want all our medical doctors watching to know that there is obviously that urge to do everything naturally, because we are natural beings, but there are moments that we need either medications or surgical intervention or some other things to be done. So Ryan, give us a little bit more details on the more serious cases and how do you know and what people should do.
Yeah, sure. I mean, so much of this comes down to responsiveness and intensity of symptoms. So, if I have a patient that is, vomiting regularly from migraines, I'm sending them to a neurologist right away, because that can be so detrimental to their health, and they might need to be on a medication short term to help bridge the gap until we have, until we can kind of put the fire down enough so that we can get to the root of the problem. So vomiting is one thing that if it's happening once in a blue moon, when somebody has a migraine, that sometimes we get patients who, if they get a really bad one, they might vomit. But if it's happening regularly, I've sent people to neurologists for that who were, trying to come in. If something is intractable, meaning it's constant and it's not going away even for periods of time, to me, that's a red flag that something is very wrong. And I usually will send somebody to neurologists when that's the case. Usually with migraine sufferers, as most people know that might be watching this, they come and go, they're not constant. But occasionally we'll get somebody that's had one that has kind of lasted for days on end. And in those situations, I get a little concerned that there might be something else going on that is acute. And, that's where a neurologist really needs to shine and do their thing. And we want to give them that opportunity to have a quick impact on the patient.
Dr. Todd, any other symptoms you would add to this?
Yeah, some other medical emergencies. One was Dr. Lisa brought to my mind years ago. One of their patients that you saw before I joined the practice was when a patient has very rigid neck with it associated with a fever. You're thinking possibly meningitis, please go to the emergency room. If all of a sudden you say, hey, the worst headache of my life, and by the way, it just exploded like a gunshot went off from my head. Again, please go to the emergency room. Headaches associated with all of a sudden I can't move my arm, can't move my leg. Please go to the emergency room. These are quick things. If you don't get headaches regularly and now you're getting regular headaches, please get that checked out. Those are a lot of times some of the simple things that we associate. So when you're getting a functional loss, can't move my face, can't move my arm, please, you got to get that checked out before. It's amazing some of the things once patients develop so much trust in us. I'm amazed that the level, and Dr. Lisa, you can speak to this, and Ryan, you can speak to this as well. About once a month, a person will come in with some severe, oh, I heard you're really good with this. And oh yeah, I never get migraines. This is the worst migraine of my life. We're getting you out of here. We're going to get you assessed first. And then once we get you stepped down, once we get your nervous system calmed down, then go from there. So those are some things to look for. Great question.
Totally agree. Totally agree.
What
yeah,
about
guys, if I missed something, or hey, other providers have other things that we missed that we're looking for, obviously this isn't going to be a differential diagnosis lesson on every nasty headache. But if something feels really, really off, you got to get that checked out first. Then we'll take good care of you.
What about vascular issues? Maybe one of you could talk about vascular issues, because there are some patients who have major problems with that. There are patients with high blood pressure and different medical conditions that can cause chronic headaches. And I wanted to ask you, how you would work. Maybe now let's talk about collaboration, how you would work with different practitioners, at which point you refer, and we talked a little bit with Ryan about it, but also, what are some of the other symptoms and assessment tests that you can take that's like, oh my God, that may be a vascular issue, or sometimes could be as simple as checking their blood pressure maybe in the office, but sometimes maybe a much more complex test that is required. So let's talk about that. And whoever would like to take their question, I would be very happy to hear more.
I find that a lot of those patients have already been the medical route, and they haven't found what they need. If they've had ongoing headaches and they know they have high blood pressure and their medical doctor has put them on this medicine or that medicine, and sometimes it helps and sometimes the blood pressure doesn't go down anyway and the headache stays. So then oftentimes we're the second, we're the next step for them. And the ones that we really have to look out for are the sudden ones, like that kid who came in. Oh my God, he had meningitis at the end of the day, and the parents were just saying, "You must see my child." And I said, "No, he's out of here. I'm about to call an ambulance. I think he's got meningitis." And I think I must have told him that, because I couldn't get him out of the office. They wanted me to treat him, and it was not my wheelhouse, as they say. We want to make sure the person's not having a stroke. We want, if something comes on suddenly, and I think after we've been in practice for a while, we kind of get a feeling for it. Hey, this one we need to refer out. So some of it is our intuitive and educated sense, and we have to often fight the patient, because as Dr. Todd was saying, they trust us, and they should trust us. And right now they should trust us to send them to the emergency room. So, it doesn't happen that often at all. But when it does, it's really important that we get that medical assessment. And then there are those people who just, they're just not coming along as well as I want them to. And I have the feeling, let's just go ahead and get them, go to your medical doctor, get a workup. Let's make sure we're not missing something.
Yeah, I would add that there's also collaboration within the complementary field, where, you're looking at, you're treating a patient and they're plateaued, and we're doing all the things that we think are correct based on our assessment. And for some reason, they're just not responding. And so those are times where I will send a patient to a chiropractor, which is obviously something that I don't do. Or potentially, if I think that there's a hormone issue that's not responding to the herbal supplement that I might be using, I might send them to a naturopath or a functional medicine doctor, somebody that might do more of like a hormonal assessment if I can't find the responsiveness there. And sometimes it's a combination, right? So, you guys were talking about the cervical condition being a common cause of the migraines. And maybe there's a combination of a cervical issue and a peripheral nerve issue, or a cervical issue and a vascular issue. And, we kind of focus in our office on the vascular or the peripheral nerve issue. And we say, but there's still something, that really needs to be adjusted. There's something that, it's going to take us too long to allow that subluxation to fall back into place, when you could actually just be going to a chiropractor in conjunction with what we're doing. And one of us takes the lead based on the probability of what the condition is. So if I really think it's more of a cervical issue, I might say, listen, come to me once a week and go see the chiropractor a couple times a week. And then between the two of us, we're going to really get to the solution, or vice versa, So those are some ways that I think we found to be really successful in difficult to treat people, where you try something and you think it should work and it just isn't quite getting there. Sometimes it's layering in another modality that can be really effective.
I'd like to say something about acupuncture and headaches. I find that that acupuncture is often essential for moving whatever's not moving, because we can, as chiropractors, we move on a very kind of a dense structural level, and pardon me, the acupuncture, the energetic movement that occurs with acupuncture can just kind of, it's like a beaver dam, releasing that energy so that we can do more of our work. And I've worked with acupuncturists who say, they're just so stuck on a structural level that I can't get the energy to move through that. So I need you to do chiropractic, and I need acupuncturists, and I refer to acupuncture often, and I get acupuncture myself. It's so important to health. I just want to, that's a place where I collaborate a lot.
Yeah.
We love our acupuncturists. They're awesome.
Absolutely. And massage, and sometimes even physical therapy, because I don't have the time to do the hands-on work with someone who's perhaps, had some sort of injury, or they have a frozen shoulder and they need something else in addition. So there's so many ways that we need each other in terms of treating our patients. And I just love this. I'm so glad that you guys have brought us together.
I want everybody to pay attention, because as there are some things that you can do at home, and having headaches is no joke. This is very serious. And I remember at some point I had sinus infections that were chronic. I don't wish that. I don't have any enemies, but if I had, I don't wish that to anybody, and I wouldn't wish it to them as well. It's so it affects every single part of your life. And I was just a kid and didn't know why. And I want everybody to know that the key is, one, try the simple things. First, be aware that there may be different reasons why, from toxicity to dehydration to your foods to cervical misalignment to all kinds of more serious problems. But being aware why, trying some things at home, some home remedies, but also we didn't mention it, but get a good night's sleep. Because not having enough sleep sometimes will give you a really bad headache, and the simple solution will be like, hey, maybe you just have too much, and you deserve a good night's sleep with a little bit of that deep sleep that will be able to cleanse your brain. So those are the things to keep in mind. And then when you go to a practitioner, if you go to somebody who truly cares and is part of a doctors networking group like we have, I want you to feel what I'm feeling now, is that regardless of which one of those practitioners you visit, if you need the other one, they're going to refer you. And I think this is so beautiful, because you don't have to worry that much about which practitioner to see. You just need to know at some point when you need to ask for help, just ask. And this may be the very way to get rid of headaches fast, because if there is something that you cannot do at home, your best home remedies are just not going to work. It could be frustrating. So go see one of our guys for sure. Yes.
Yeah, I think you summarized it really nicely. And I think one of the indicators that a patient's going to get, and Dr. Lisa, you spoke to it immediately, you said, just, hey, what's a good indicator that I'm going to the right places? One of my friends already gone there, has somebody trailblazed for me and let me know, hey, what's the first response we get when somebody answers the phone? And then Ryan, you alluded to it more. Are they sensitive to, when I come in, are they sensitive to what it's like to even have a headache? Do all of a sudden they see it and they go, oh, by the way, let's turn down the music for you. Oh, Yes, we've changed the way our lighting is, so it's decreased for you. Are you already seeing those signs of just decent human caring to start off with? And then, Dr. Lisa, in your case, and Mike, in your case, is being providers or advocates for providers. If you've suffered from a headache of a certain magnitude, that is another level of understanding. And if you have a practitioner that goes, by the way, I've had these before too, they just know things certain ways. I've been blessed to not have a lot of headaches, but I remember one time having one so bad that I was driving to pick up my kids from school. And I was like on my will to stay on the road. And at the same time, I was going, you know what? If I crash this car and I get knocked out, I won't feel this headache. It was that bad. Part of me was going, maybe I can just crash the car. I mean, they can get that intense. And to have somebody feel that level of intensity and then feel where you are and move you forward to their best of their ability, and then use their assessment tools to figure out, is it hormonal? Is it neurologic? Is it mechanical? Is it musculoskeletal? Or any other body parts? What can I do to help you on those avenues? Okay, what have I not explored, or what do I need? Do I need to go to nutritional response? Do I need to go to acupuncture? Do I need to go to outside to allopathic medicine, and then move forward from there? So those are my thoughts, just to kind of encapsulate what we're going. But we're all about decreasing that stress bucket, taking that fear, that pain that you have, and in our way, decreasing the stress on your body. And if that's manifesting as migraines, yes, every one of us can chip away at that. And it might take a few of us to totally get that to the next level. And if it is, hey, no problem. We're all here to help you out.
Oh, this was so good. I don't even know how we can, second that. This is something that I want everybody to feel, that if you are in a situation when you're trying different things, because there's one scenario, you need to fix your headache that just came, and then you fix it naturally, fast. And I wish everybody, if that situation comes, that you have a quick resolution. But if you don't, then you need to know, you need to see the right practitioner, and you need to also know that you are also in part in control. It may feel like you're not, but you are. So one of the things Ryan mentioned is, even at the initial phone call, you can say, how do you assess headaches, migraines? What is your assessment look like? And even that answer can tell you if they really know what they're talking about. Another thing is then you may be able to see if they actually care. Dr. Upal had a great post recently about, as a provider, you need to have compassion. You need to understand your patients. You need to care. And I think sometimes the conversation with the front desk that we mentioned, and Dr. Lisa mentioned that too, will tell you, because the last thing you want if you have a headache and you go to a provider is to go to somebody who is just going to treat you like a number. I think this is a disaster, because you need extra attention. And knowing that there is a group of providers who will go above and beyond to not only understand, but also help you and collaborate with others to give you the best clinical outcomes, like we say. This is something that I'm very proud of in this group. And you see, watching this video, you see, 4 windows, 3 providers here. But I want to let you know we are growing, and we have more and more providers joining us, not only in Maryland. So if you are a patient, or if you're an individual looking for clinical solutions, ask questions. If you're a provider watching this, join our group and collaborate, because sometimes even one question and answer can help get your patients better. So that's my call to action to everyone. And I wish everybody a great night. We covered a lot today, and there's of course so much to cover, but get a good night's sleep. Remember that getting rid of headaches naturally is the ideal solution. Sometimes you can't, but if you don't know how to do it yourself, ask for help. Don't be afraid. Wishing everybody a great day. Take care.